Hey, everybody. I'm Dr. Kelly Tanner, hygiene editor at Dr. Bicuspid. And today I have with me the ultimate extraordinaire, Tami Wanless. Thank you, Tammy, for being on today.
Kelly, my pleasure. And had I known we were going to have matching twin outfits, I mean, this is completely unplanned, but I love it. So, do we need to
Same.
label who's who? Right.
I know, truly. I am so excited about our topic today about these two ADA codes that have come up this year and that help us treatment plan, help guide us to document and also that reimbursement part that can be so important for everyone. So can you briefly explain what the new ADA codes are and what they cover?
You bet. And I hesitate because anytime you talk insurance codes, hygienists can slip into a coma, right? We kind of
Mhm.
compartmentalize, codes and treatment because we don't allow codes to dictate how we provide care to our patients. So I want to be abundantly clear that these codes are helping the profession, the patients, and hygienists really have an opportunity to make an impact here, right? So there's two codes. One is D601, and that's implant maintenance involving a full arch removable implant supported prosthetic. That covers like removable, cleaning, reinsertion of the prosthetic. And I think of this as like a comprehensive tune up for patients with large prosthetics. I work in private practice outside of Chicago. And when we would remove these, I'd use the air polishing technique and clean them. And give that away, right? That was just part of we want to take care of the patient. So the idea behind having this code now allows us to quantify what we're doing, not only for the patient, but for the insurance company. So it's things we've already done. Now we just get support for that. So that's the first code. The second code I really like because I say all the time to my students, an implant's not a tooth is not an implant. As simple as that sounds, we would treat them all the same. So we're using different instruments, we're using different techniques at times, but we're still charging for a prophy, 1110, right?
Yes.
This new code, D6081.1, it's scaling and debridement of a single implant and that's in the presence of peri-implant mucositis or, without that flap entry. So this is non-surgical chairside intervention. It's what all of us hygienists are doing around this implant, and it's targeting that inflammation. So mucositis is just like gingivitis, changing color tissue, bleeding. That's the inflammation around that one implant. We want to get it before it progresses to peri-implantitis, which is
Not affecting the bone. It's
exactly
only in the tissue. It's the tissue is the issue in this.
reversible. That's the difference between mucositis and peri-implantitis is the hygienist can make a powerful impact on that. Exactly, Kelly.
This is so great because when I discovered that these new codes came about, I was thinking, to your point, finally, well, we know that we're always trying to get more time. And it used to annoy me to no end that I just wanted to get underneath the fixed prosthesis. I'm like, can we just take it back? When can we take this out? What year does it have to be to take this out so I can see what's under it, so I can debride, so we can examine it? And so now there's a code that then will help to maybe give us more time too, Tammy.
Yeah, I like the way you're framing that because I really think these codes help us recognize the unique challenges of maintaining implants and provide a clearer pathway for documentation and reimbursement. So, documenting, again, I say this all the time to my students. Imagine this chart on a big PowerPoint, in a courtroom, documenting what we're doing and actually getting reimbursed for it. So, yeah, I agree with you. It's rare that we get excited about insurance codes, but I feel like these two are finally going to support, again, both us and the patients. Yeah. So before these codes, hygienists often had to just fit implant maintenance into their existing treatment codes, like a 4910, your periodontal maintenance, or your prophy. So this kind of created an ambiguity and often really undervalued the specialized work that's required for implant maintenance. And again, hygienists, we gravitate towards dental hygiene because we like helping people, but it really did undervalue what we did. So the documentation was vague. Insurance reviewers and offices didn't have a consistent way to differentiate implant specific therapy from traditional debridement. So now with these codes in place, we have precise language. It reflects that clinical reality of treating implants Again, hygienists have that, I'm just going to get it done type of mentality, which is great. But we were giving away a lot of dentistry. And this is one way to differentiate that.
I agree, and it's similar to I'm even thinking it's similar to the care that you provide in the presence of gingivitis for for natural tooth surfaces, or that you're including codes also for the treatment of periodontal disease. So it does specify that. So I think it's brilliant that they've created these codes that do allow us to be able to document what we're doing around what and the extent to which the degree that the disease is present. So only mucositis hasn't progressed. So I think it supports everyone. So what are you seeing as a hygienist with the increase in implant dentistry where this might be used?
Yeah, well, I'll tell you, this is kind of a game changer for hygienists. I do a lot of mission work, and I can tell you this last mission that I did, we had patients presented with implants, and we were scrambling with a mission group, right? Like, we're not used to seeing that demographic here in the missions. That tells me two things. One, there's a lack of care everywhere for underserved populations, but the number of implants placed, I mean, the data supports that the number of implants placed, the amount of time that implants have been is significant. So hygienists are doing it's almost the norm. We used to, when dental hygiene and implants just came together, we had that one implant instrument that looked like you could pick olives out of a jar with it. And it just made us feel good to have it on the tray, right? So kudos to our profession and kudos to the manufacturers that have really helped us evolve into how we treat these patients and how we can actually have an impact on it. So, we're the front line typically once implants are placed. And so it's up to us to educate the patient and make sure that we are treating these aging implants
Right.
and the new currents because the implant materials are changing, the way they're placed is changing, which again is our profession is constantly evolving. We have to stay on top of it with it. So you know, for hygienists, we're differentiating now between biofilm removal and natural dentition versus implant surfaces. And I use the word biofilm, and I'm old enough to say I have seen the nomenclature also change, right? From plaque to biofilm. And so using technology and instruments that are safe, the biggest game changer that I see is how I treat implants. Well, how I treat patients in general, but it helps support it. And the game changer for me is air polishing and patient education protocols. So, frankly, it means I'm catching more peri-implant disease earlier, which is where these new codes are so critical. Is that I always tell the students and practice myself, let the tissue color drive where and how I'm going to treat this tooth or this implant. So again, changing color tissue, any bleeding, those are things that are going to drive me to use these types of codes where I have that single peri-implant.
Yeah, and I was thinking too, in terms of to your example of the mission trip, there are many patients who didn't get the implants placed in our practice or under our care, and so we're the recipients of a lot of implant patients. We have no idea what the history is here,
Mhm.
so it's nice to be able to apply the code, to document the changes over time, to be able to describe what it is, stages of health, and then how we are caring for this. So what do you think is the clinical impact of the growing need
Mm.
for implant maintenance for the hygienist?
Yeah, so we really need to develop an expertise in, everyone hesitates to say diagnosis, but I'm going to say a dental hygiene diagnosis with our diagnostic tools, which is probing, identifying bleeding, mobility, radiographic changes.
Mm.
There are some beautiful implants. And I sometimes a patient will sit down and the original implants, I am going to say like you can see the original implants, right? How the tissue reacted but now there's so many beautiful implants. So we need to recognize that peri-implant disease progresses much faster than periodontal disease. So we don't have the luxury of saying, "Oh, it's just changing a little bit, we'll keep an eye on it." And I'm not a fan of watching something turn into something bigger. I recently heard a student say, "Well, you kind of have perimucositis." And so I said to the student, "That's like being kind of pregnant."
Exactly.
Right? So let's rip off that Band-Aid, let's call it what it is. I think we hesitate sometimes to tell a patient that because we want things to be so positive, but we really do have to identify it, and that changes the workflow. So it changes the type of instruments I'm gonna use, it changes my education. I might need a different appointment, I might need, more time. So, you identified time, and sometimes, if a patient presents healthy, that's the amount of time that I have allotted. If a patient presents with disease, I need to stop. I need to change instruments. I need to pivot my home care. We need to maybe, change workflow that might require extra time. And instead of trying to jam everything into my 60 minutes, I'm going to pause and say, okay, what do I need to do? And tailor that maintenance schedule too. So not only do I want to pause and make sure I'm treating everything that needs to be treated, but then pivot on my recall. Is it 6 months? Is it 3 months? Is it 1 month? So there's hygienists, it adds a little bit more complexity, right? And one of the things you said is time,
Mhm.
right? Hygienists are constantly trying to squeeze more things into that same 60-minute appointment. And
Yes.
so, but we also have to respect that professional value where we're the first line of defense with implant success. So once that implant is placed, they're in the hygienist's hands, right? And so we have to be that first line of defense. So that's how I see it.
Yeah, and I like your point too with pivoting with the tools and our workflow and how we're caring for that. Because with the emergence of understanding what biofilm really is and caring for the patient, for the tissue, for the whole person, it's evolved how we care and what we're picking up on our tray and that's not on our tray, right?
Exactly. Well said. Well said.
So
Yeah.
what type of technology are you using and how do like these codes affect how hygienists manage peri-implant maintenance with the PWR pair that I know that you're comfortable with using?
Yes, I'm going to tell you a great story. So, the practice that I work in, the doctor knows I'm a huge geek and I'm always on the cutting edge of technology. So, when I incorporated the power pair, he was like, okay, what is this now? What are you doing? What's going on? And air polishing is huge with glycine. That powder is a game changer. So, glycine requires special technology. The patients love it. But I started incorporating that as a predictable, minimally invasive way to clean implant surfaces without damaging the titanium. And the story I started to tell you was the practice, the dentist started going to more seminars on implants. And he said the first seminar he went to, the speaker said, raise your hand if you're using air polishing with glycine. And he said, I proudly raised my hand and said, my hygienist brought this technology in. And he was the only office. And the speaker said, this is the pathway. This is what everyone should be doing. So the doctor came back and was like, you are free to be a geek. This is great, that you brought this technology into the practice. So, um, polishing can be used around implants. It can be used around natural teeth. It really is the only thing I've ever used on an implant that I feel that I am making a impact and removing the biofilm. I talked about that first generation instrument, right? Where everybody went in and we went, it looks good. I'm not sure if
Does
it's
it
getting
fit?
anything done. Yes. The one size fits no one. So instead of shoehorning that procedure into the prophy, we can code air polishing now. And this legitimizes modern implant maintenance. Subgingival air polishing is now the standard of care. I will tell you, I had a patient that moved to Arizona, and, patients have nicknames for everything. And she called me and said, hey, what do you call the car wash thing that you use on my teeth? And I go, what? We don't. And she goes, I went and had my teeth cleaned, and they're not as clean as when you clean them. It's that thing, right? That you started using. I think that's how air polishing has changed dental hygiene in general, but implant maintenance. I mean, I can literally see the air lets me see underneath that implant so I can see what I'm doing a lot better.
Yes.
And it's kind of the tissues. It is so minimally invasive that I feel good about it, that I'm actually removing the biofilm. I can see a difference. Patients can feel a difference. The glycine powder does more than just remove biofilm, it initiates that inflammation process, which is the first step of healing. So, gone are the days that air polishing was just sodium bicarbonate and messy, and it was messy for us and the patients.
Yeah.
This is so much more modern and it really is effective. You'll see a difference. I saw a difference in my practice just when I started using it right away.
What a difference it makes being able to use a powder, a material that we know is gentler to the tissues. And so, with the Power Pair, Tammy, how do you think this benefits patients with dental implants?
Well, it benefits patients in multiple ways. So, first is early intervention, right? So, hygienists can treat that peri-implant disease non surgically and it's billed appropriately. It catches the disease before it requires surgery.
Mhm.
So, the pain point is always find out what inspires your patient. Is it finances? Well, then this is going to make much more sense. Is it discomfort? Again, this makes much more sense to catch this before it becomes a surgical issue. It also customizes that care. So patients with full arch prosthetics get a thorough maintenance that's recognized by insurers. So, when we remove that prosthetic, I'm also maintaining that piece and the natural tissues as well. So that's the second benefit. And then implant longevity, an implant is an investment. When I have a patient that's lost a tooth, some patients are candidates and some are not. So if they're not going to quit smoking, they're not a candidate. If they're not going to improve their oral hygiene, they're not a good candidate. So accurate coding allows practices to schedule the right amount of time, the tools for the implant patients, increasing the lifespan of that investment for the patients, and transparency. I really think patients see implant care that it's valuable and not just another cleaning or prophy, right? Like, so patients are picking up on dental nomenclature, prophy, bite wings, right? They'll say things like that. And it's important that I reflect that. And I do that, that starts all the way from when they make the appointment. So when I never like to identify the people at the front desk by a piece of furniture. So when our receptionist schedules an appointment, she pulls that up and says, "Oh, you have an implant. Okay, great. Let's give you the amount of time that Tammy's going to need to make sure we take care of that, right? Or are they healthy? Are they struggling? Are they in a disease state? That's going to require more time." So, that transparency, ultimately, the codes help, let the patients stay healthier longer at a lower cost by supporting those preventative and early intervention strategies.
Yeah, it benefits everyone in so many ways, and it again allows us to understand the condition, the treatment, all of the things that are threaded through that patient's life span, and for how we've cared for that patient with the dental coding. So, Tammy, thank you for simplifying these codes for us and talking about your personal experience. If you want to know more about the Power Pair, there's more information in the show notes. And Tammy, thank you so much for your time today.
Thanks, Kelly. It was my pleasure.
Yeah, this is Dr. Kelly Tanner. I am hygiene editor for Dr. Buck Husband. Thank you, everyone. And thank you, Tammy. And be well, my friends. Take care.